Number 4, N-acetylcysteine is known to help relieve symptoms of respiratory conditions. N-acetylcysteine as an antioxidant helps replenish glutathione levels from your liver. And that glutathione level will go to your lungs, and it reduces inflammation in your bronchial tubes and lung tissue. Some studies even suggest that taking N-acetyl supplements can help improve COPD symptoms, exacerbations, and lung decline. Well, how many people do you know that have COPD or have asthma or have chronic pneumonia? You might want to tell them about NAC because it's proven to do that in multiple research studies. People with chronic bronchitis can also benefit from N-acetylcysteine, says Healthline magazine. Bronchitis occurs when the mucous membranes in your lungs, bronchial passageways, become inflamed, swell, and shut off airways to your lungs. By thinning the mucus in your bronchial tubes you breathe through and boosting glutathione levels, NAC may help decrease the severity and frequency of wheezing, coughing, and respiratory attacks. N-acetylcysteine may improve other lung and respiratory tract conditions like cystic fibrosis, asthma, and pulmonary fibrosis. I don't know if y'all know about pulmonary fibrosis. That's where your lungs turn to cartilage. Right now, the only thing doctors tell you is that you have a lung transplant in your future. And if you don't get one, you're dying. Where you're learning right here that N-acetylcysteine found in our store at the Dr. Ardis Show is known and found in studies to help improve cystic fibrosis, asthma, and pulmonary fibrosis, as well as symptoms of nasal and sinus congestion due to allergies and infections. Well, we're about to move into winter and summer or spring now in 2024 and into 2025, and you're going to see massive seasonal allergy symptoms. Well, now you know what you can use. Now, there is a drug that's commonly used right now for the flu season and respiratory infections called Tamiflu. Did y'all know that Tamiflu has common side effects to increase phlegm-producing coughs? Tamiflu does, and also can increase your wheezing. And did you know it can create shortness of breath, faster irregular heartbeats, facial swelling, unusual weight loss, diarrhea, watery and severe, and bloating? These are just some of the other side effects known about Tamiflu. Well, N-acetylcysteine is one of the 5 ingredients in my Doc's Viral Defense that we created and formulated during the COVID-19 pandemic. They called it a respiratory virus. I wanted to make sure people knew N-acetylcysteine is able to prevent respiratory infections. All of them, like I just showed you. Number 5 benefit by Healthline magazine is boosts brain health by regulating glutamate and replenishing glutathione. We've already seen a reference to this. Because N-acetylcysteine helps regulate glutamate levels, which are important in OCD, schizophrenia, and bipolarism and depression, because N-acetylcysteine helps regulate glutamate levels and replenish glutathione, it may benefit those with health conditions affecting the brain and memory. Alzheimer's disease slows down learning and memory capacity. Animal studies suggest that N-acetylcysteine may slow the loss of thinking ability in people with Alzheimer's disease. Did you know Parkinson's disease is characterized by the deterioration of cells that generate the neurotransmitter called dopamine? Anybody diagnosed with Parkinson's, has a loved one on Parkinson's, you know their drugs they take are titled this: L-Dopa, Cardopa. Dopa is short for dopamine. We all know the correlation between Parkinson's and this hormone. N-acetylcysteine supplements appear to improve both dopamine function and disease symptoms such as tremors in Parkinson's patients. Now, there are medications that are prescribed for Alzheimer's and Parkinson's, and some of those are called these. You'll see them highlighted on the screen. This is from the NIH's website. Galantamine, benzgalantamine, rivastagamine, and donepezil are cholinesterase inhibitors that are prescribed for mild to moderate Alzheimer's symptoms. And these drugs may help reduce or control some cognitive or behavioral symptoms. Well, let's see what the side effects of these are. N-acetylcysteine doesn't have any of these, but it's important for you to know. Galantamine, going to drugs.com. You see there's serious side effects. I want to read these to you. If you have Alzheimer's, have a loved one with it, this is most likely what your neurologist is going to prescribe. Did you know that chest pain or discomfort is a common side effect? Did you know dizziness and fainting in your elderly and Alzheimer's patients is a side effect of the drug? Shortness of breath, shakiness in the legs, arms, hands, or feet. So tremors, slow or irregular heartbeat, and unusual tiredness. Blurred vision, confusion. Oh my goodness. Alzheimer's comes with dementia. You don't think they're already struggling with confusion? These are also published side effects, although rare, they say, that's still known to cause it. Fainting is a side effect of this drug for Alzheimer's. Fast, irregular pounding or racing heartbeat, rapid breathing, dizziness, faintness, or lightheadedness. These are all published side effects. Trouble breathing, sunken eyes, wrinkled skin. Y'all want to look older? All this anti-aging stuff you're reading about. That's only if you want the drugs. N-acetylcysteine doesn't do any of that to you Alzheimer's and Parkinson's patients. Number 6, N-acetylcysteine may help improve fertility in both men and women. This was exciting to me. Why? I have 5 kids myself. My wife has 3. We have 8 together. And there's a whole lot of people struggling in the world right now to conceive. If you have any children, grandchildren who are struggling to maintain a pregnancy, getting pregnant at all, seeking fertilization treatment, you might want to consider N-acetylcysteine after I read to you what you're about to hear. Approximately 15% of all couples trying to conceive are affected by infertility. In almost half of those cases, male infertility is the main contributing factor. Now, this is important because most infertility clinics will tell you it's women's faults. No, over half of all infertility cases, it's blamed on the men. Many male infertility issues increase with antioxidant levels are insufficient to address free radical formation in their reproductive organs, testes. In one study, 35 men with varicocele received 600 milligrams of N-acetylcysteine. Now, varicocele is like reduction of semen, reduction of sperm, and reduction in sperm swimming ability. So in this study, 35 men that had this problem with infertility received 600 milligrams of N-acetylcysteine daily for 3 months after surgery. Their combination of surgery and N-acetylcysteine supplementation improved semen integrity and partner pregnancy rate by 22% compared with the control group that saw no improvement. When it comes to treating males for infertility, you'll see on the screen the most common drugs they use. Clomiphene or Clomid is the name of this one. I want to show you what are some of the known side effects of this male infertility drug. N-acetylcysteine doesn't do this. Clomiphene, otherwise known as Clomid as a brand name. Clomiphene is a non-steroidal fertility medicine. What are its serious side effects? Look at this: bloating, stomach or pelvic pain, blurred vision, seeing flashes of light, sensitivity to eyes to light, yellow eyes or skin, that's jaundice from liver failure, decreased or double vision, or other vision problems. And acetylcysteine doesn't cause any of that issues. Did you know that it also has less common but rare side effects also? I mean, these are awful. Breast discomfort, dizziness or lightheadedness, headache, heavy menstrual periods in females, mental depression. You're already depressed if you can't have a baby or expand your family. Why add depression to the list? Nervousness, trouble sleeping. N-acetylcysteine doesn't have that effect. Now, I'm going to show you a research study that highlights just how impactful N-acetylcysteine helps with fertility issues. You're going to see it here in just a minute. Healthline magazine also states, N-acetylcysteine may stabilize blood sugar by decreasing inflammation in all of our fat cells. Animal studies show that N-acetylcysteine may stabilize blood sugar by decreasing inflammation in fat cells and thereby improving insulin resistance. That's all of you type 2 diabetics. If you're on metformin, glucophage, you name it, or even insulin. Insulin resistant means your body's making insulin, but it's not breaking down blood sugar. There's a couple things here. N-acetylcysteine stabilizes blood sugar and improves insulin resistance. But don't forget bioactive copper. The enzyme required to make insulin break down blood sugar is copper dependent. That's 1 capsule of our bioactive copper at the Dr. Ardis Show also. Just speaking about diabetes and blood sugar. All right, now when it comes to blood sugar, one of the most common prescribed drugs is glyburide. Diabeta is the brand name, Glinase or Micronase. Sounds like mayonnaise. All right, what is glyburide? It's an oral diabetes medication that helps to control blood sugar levels. And acetylcysteine does it, and it doesn't require a prescription, and you won't see it on drugs.com. What are some of the serious side effects of this blood sugar drug? Oh, it only causes difficulty swallowing, dizziness, fast heartbeats, skin rashes, puffiness of the swelling of the eyes or around the eyes, lips, face, tongue, tightness in the chest, that sounds like a heart attack, trouble breathing, that sounds worse, unusual tiredness or weakness, and then vomiting of blood is a side effect of this drug. I don't like that one. diarrhea, clay-colored stools, nausea and vomiting, unpleasant breath odor. Sounds great. They don't know how many people this affects, but these are published side effects of this drug called glyburide. Look at this. Incident isn't reported yet, but they know it is published. Look at coma. Did you know this diabetes drug can cause coma? Cause you to go into a coma. I don't like that idea. N-acetylcysteines never caused a coma in anybody. Bleeding gums. That sounds amazing if you take that drug. Blood in the urine or stools, more kidney failure, back, leg, stomach pains, convulsions are a side effect of this drug. Depression is a side effect of the drug. Irritability, general body swelling. Who doesn't want their body to swell? I can't even think of anybody who doesn't want their body to swell. Everybody loves swelling. Sore ulcers. Stupor is a side effect of this drug. Do you know what stupor is? You can't get them to wake up. You can't get them to look at you and talk to you. They're just sitting there in a stupor. Can't react to anything you're doing. Now back to N-acetylcysteine. Just showing you what it is your medical doctor will often prescribe, but NAC is already proven to do the same thing without those horrible side effects. Number 8, N-acetylcysteine may reduce heart disease risk by preventing oxidative damage. Oxidative damage from stress to heart tissue often leads to heart disease, causing strokes, heart attacks, and other severe conditions. N-acetylcysteine may reduce heart disease risk by reducing oxidative damage to tissues in your heart. Anybody out there with heart disease? Studies show that N-acetylcysteine may protect heart function and heart health in people with diabetes and those recovering from certain heart surgeries. How amazing is that?